Welcome to Healthcare Leadership in an Era of Patient Empowerment. I'm Mike Useem. I'm on the faculty of the Wharton School. I direct the Wharton Leadership Center, and we're going to be working together in the weeks ahead on your own leadership. And for that, useful at the outset here to think briefly about what we really mean by leadership. A couple ways to get at that. One working definition is that in a leadership position, you have to think about everything. In your case, patients or customers that are coming in for your services. But beyond that, budget. That's your responsibility as a leader. How do you bring patients to where you're located? Call that marketing. So leadership is a matter of bringing all the functions together. It also, more specifically, is concerned with a couple particular agendas we're going to work on in this course, which is how do you motivate people in the best possible sense of that phrase to work with you, to get the job done, to take action before you tell them what to do and knowing what they should be doing. How do we get people energized? How do we bring out the best new ideas that they have and sometimes we just don't see? And above all, leadership is really working with everybody to focus in on your team's or your organization's mission and its strategy. The course is designed to work with you to bring out, for example, I've already referenced it, how to motivate and align those working with you. It's designed to help you strengthen your leadership to do that, and another half dozen or really a dozen topics we're going to be working on. And for that, the agenda we're going to be looking at here is maybe best framed by asking you to think about what you were given when you took your current position and what are you adding above and beyond what the team, the organization, the enterprise, the center has given you by way of budget and staff. Leadership in that sense is often viewed as value add. What can I add to what I have been given that somebody else maybe in different form may not have been quite so good at doing? I'm going to make a division here between what I will term personal leadership and organizational leadership. Personal, it's all about you, the experience you bring, the vision, integrity, your sense of determination, your grittiness. Organizationally, we also are always concerned about can we, for example, redesign the organization to deliver services better, maybe make it more patient-focused. And thus, our leadership terrain in the days ahead is going to be both personal and organizational. A quick question to just debate in your mind as I walk through it, and I'm going to do this frequently, is to take a look here, in this case, at the Walt Disney Senior Management Team as of now. At the upper left, on the front of Fortune magazine, the upper left there is Robert Iger, top Chief Executive Officer of the firm. And a question I've often asked, and we're going to be asking this question, to think about Disney and where it's going. New theme parks, for example, now one just opened up in China, pictured there at the bottom left. Question is this Bob Iger's show? Is it his leadership above all, or is his leadership exercised in collaboration with the team? The research says, with exceptions, but statistically speaking, on average, as we think about a center, a team, a group, a club, a foundation, a medical center, the leadership of the entity should be thought of as both a team and an individual sport. The future Disney depends a lot on Bob Iger, arguably equally, and evidence supports this. It also depends on the team of people he has built around them. And while we're looking at research on this, I do want to reemphasize the point really behind why we're doing this course now, which is that when organizations like your own are looking or facing a changing, uncertain, sometimes unpredictable environment, the impact of the top one and the top team and you will be greater than when the enterprise is looking at a more predictable, less changing world around it. That said, given the fact that so many areas of American life now are directly affected by new technologies and new competitors and new ways of getting the job done, this, by implication from that research, is a great time to work on your own leadership development because the world ahead is going to be choppy and unpredictable. Got to have leadership in place in that sense before we need it. Couple key questions for the course. I'd like you to be thinking about this now at work. Take these questions back to your workplace, bring them into the course. What leadership capacities in particular make greatest difference? We're going to have to get a hold of that. And once we've got that figured out, then we have to think about how do we actually strengthen our leadership, and can anybody, or everybody for that matter, become better at the art and science of leading? Those are among the questions we're going to be looking at in the weeks ahead. And I'm going to end here with a brief reference to a case that we're going to take on later on. By case, we mean a moment when all these issues really come to the fore. We're going to be focused on the 20 million people, mainly in West Africa, a bit in Central America and South America, who carry, by common reference here, carry river blindness, a parasite-caused irreversible condition of enduring blindness, but other terrible consequences as well. And we're going to be focusing on a healthcare worker at Merck & Co., the big pharma company, who knew about the disease. He knew that Merck had a product that might be, if evolved and tested, effective against this disease or river blindness. And from a leadership standpoint, we're going to be asking the questions: what should he think about? Who should he engage? If he decides to go forward with this, how does he bring the company into producing a drug, in this case, that 20 million people need? Even if you make it, it's going to have no financial value for the firm directly. So we're going to be wrestling with all those issues, those dilemmas, in the time ahead. Quick final summary of our brief time together. Very important at the end of each of our segments to engage what is often called an after-action review. Looking back briefly to get some ideas that are tangible and applicable when we get back to work later today or tomorrow. Number one, very good, I ask you to do this, reflect and build upon your own leadership in the weeks ahead. Just think about how you lead, how people around you are making a difference, for better, sometimes for worse. Number two, a way to think about leadership is going to be the foundation of what we're doing, is what can you add above and beyond what you were given on taking office to the office. Finally, and this is why we're doing the course now, leadership makes greatest difference in dynamic, risky, uncertain environments. That seems to describe pretty much everybody's world these days, and thus will be vital, very vital in healthcare during the years ahead. Hence the course. Great to have time with you, and I look forward to our next segment.